Okay, today's class is more about bahye snehana procedures, and I will be taking sneha karmugada. Okay, mode of action also. Pada, gandusha, kabala, talapodichil, then sneha karmugada. These all I will be today discussing with you. Okay, bahya snehana. Application of snehana externally for the purpose of snehana. That is bahya snehana. Bahya means external. And it is practiced as a part of dinacharya and ridhucharya. You have learned in Ashtanga Sutrasthana in first year and all. And in deceased, it is used for shamana chigilsa, also as a part of purva karma before the administration of shodhana. Snehanam, Swedanam. In the introductory class, you have learned how to do Snehana and Swedana. For what purpose you are doing this Snehana and Swedana before Shodhana Karma. And also it can be Sthanika and Sarvadehiga. We are doing local massage and full body massage. That is Sthanika and Sarvadehiga. Next, some factors are to be considered before going to do this Bahya Snehana. Again, exam point of view, you can omit these points for just for your knowledge only. I am sharing with you. This these are the factors: Prakriti, Dosha, Dushya, Desha, Kala, Agni, and Sharira Bala. Coming to Prakriti, we are analyzing this Prakriti to select the suitable kalpanas, whether oil, which oil we must take for this Bahya Snehana procedure. That is related with this Prakriti of the patient. Then dosha. First is Gadatwa, then Utklishta dosha and Ama dosha. 3 points are coming under this dosha. Means Gadatwa means indication of labor. We can see in later in Kaya Chikitsa and all, you will study that Twagada Kushta and Mamsagada Kushta, we are using this various types of labor. It is mentioned in our classics. Also, in Uttanagada Vadarakta, we are applying so many labors. Then Utklishta dosha. In this condition, we cannot do this labor. That is, labor is contraindicated in this condition. Then coming to Ama dosha. Ama dosha, we have already learned in the contraindications of Snehana that Bahya Snehana is not only Bahya Snehana, internal Snehavana is also contraindicated in this Amadosha condition. Next, coming this Dushya. According to Dhadu involvement, this therapy differs. That is, this one also you have learned in the last class. Mamsala, Medura, Bhuri, Sleshmano, Vishamakneha. In that Mamsala patients, all this Utsadanam, Abhyanga can be done. Mamsala means if Mamsa Dhadu is uh, less with the patients, we can do this Utsadana, Abhyanga. It will nourish the Dhadus. Then Meda, to remove this Meda and Kapha, we are doing this Udvartana. Also in Asti Majja, Gada Vadam, Bahya Abhyandara Sneha is mentioned. You will also learn in Vada Vyadi Chigilsa coming Kaya Chigilsa classes. Then Desha, in region or part of the body. In Svedadhyaya, you will be going to learn Mrudu, Madhya, and Mahasveda. That is, we cannot apply this Mahasveda in face and all. That drug penetration level will be different in face, the chest region, perineal region. So that you will learn in Sveda coming classes. Okay. Then Kala. Daytime is more preferred for this external therapies. According to Rudu, this duration and type of therapy differs. Then coming to Agni. Agni, you know this Brajaka Pitta is the Twaksta Pitta. The Pitta which is located in Twak, it is Brajaka Pitta. And the Abhyanga is contraindicated in severe Agni-mandya, Ajirna, Amadosha. So this Brajaka Pitta and Jadarakni are to be considered before doing this Bahisnehana. Then Sharira Bala, as I told, this Mahasveda is indicated in Uttama Bala patients. That Mrudu Sweda is indicated in that type of persons. You will learn in the Sweda classes. These are the factors to be considered before Bahya Snehana. Prakriti, Dosha, Dushya, Desha, Kala, Agni, and Sharira Bala. If you can remember any one or two points, you can just write in your exam. Not necessary. Next is pharmacological considerations. These are nature of drug. Then dosage, regional anatomic variation, altered barrier function, hydration, vehicle, application frequency. This one, this or in these also you can write this nature of drug. You can write dosage, application frequency. Okay, we'll detail it now. First is the nature of drug. This penetration of a drug depends on the ratio between lipid solubility and water solubility of a drug. In the last class, I have told that in our body, some biochemical substances are produced, isn't it? That may be water soluble, either water soluble or lipid soluble. And this ratio between this lipid solubility and water solubility of a drug depends upon this penetration of that drug. Also, this penetrating order of oils is mentioned as animal oils is greater, vegetable oils then comes the mineral oils. That is why this vasa majja it will penetrate more. So in this dhadukshaya condition, vardhakya in degenerative osteoarthritis condition, this upanaha of vasa will work more. That is the penetrating order is more. Then nasal medications, highly fat soluble, slightly water soluble, and have aroma. That is the qualities of that. That must be the qualities of a nasal medications. Then coming to dosage, amount sufficient to cover the affected body surfaces. Means if you are applying a laba in some conditions, disease conditions, say for example in knee osteoarthritis, in Janusandhi, we are advising the patient to do this Janusandhi laba. So we must cover the full Janusandhi. That is the dosage, amount sufficient to cover the affected body surfaces. Next is regional anatomic variation. That is permeability is inversely proportional to the thickness of the stratum corneum. Stratum corneum is the skin layer and the first layer. That if the thickness of stratum corneum is more, then the permeability will be less. That is, this drug penetration is less in the drug penetration is more in the face and all. That is, the sweda, Tikshna sweda is contraindicated. So when the permeability is increases, when this permeability increases, when the thickness of the stratum corneum is less, that the drug can be more permeable. Then altered barrier function. In psoriasis patients and all, you have seen that the skin barrier function is lost, and this one study was there and they concluded that efficacy of a topical therapy depends on understanding the barrier function of the skin primarily with the stratum corneum. And coming the application frequency, often applied twice daily. We advise this laba and all to apply twice daily, and the stratum corneum act as a reservoir and it allows gradual penetration for a prolonged period of time. These are the pharmacological considerations: nature of drug, dosage, regional anatomic variation, altered barrier function, hydration. Hydration means in coming procedures, you can see we advise to do this laba in wet condition. That is the hydration. Then application frequency. Okay. Coming to the procedures, first is Abhyanga. This is not mentioned in your syllabus, but you must know this Abhyanga. Bahye snehana means first this Abhyanga will come into our mind. No? Ang dhadu means motion and Abhi upasarga. From this two terms, this Abhyanga word have derived. Okay. That is motion in different directions, anointing the body with oil or ghee. That is the Abhyanga. Types, this in Vatsyayana Kama Sutra, it is mentioned as three types, that is Samvahana, Keshamardana, Utsadana. According to Tiruka, author of Anga Mardana. Okay, this I will discuss in this Mardana point. That is Shushka Anga Mardana, Taila Anga Mardana, Kshira Anga Mardana, Swayam Anga Mardana, Yamalanga Mardana. These are the types of Abhyanga. What are the benefits of Abhyanga? This you have learned in first year and all. Abhyanga Majare Nityam Sajara Shramavadaha Drishti Prasada Pushti Ayu Swapna Sutvakta Dardagrt. That means we can explain this. Jarahara means prevents and corrects aging process. Shramahara means overcome fatigue. Vadahara means helps in promotion and regulation of Vada. Drishti Prasadagara promotes eyesight. This Drishti Prasadagara, if we do this Padabhyanga regularly, the eye vision can be improved. Okay. Then Pushtigara helps in nourishment of body. Aishyakara promotes longevity. Okay. Then Swapnakara overcomes sleeplessness and other mental ailments. Then Twakdardigara, continuous usage of Snehadravya's promotes the sturdiness of an individual. Okay, then Klesha Sahatva, capability to tolerate the stress and strains of life. Abhighata Sahatva means if we get any trauma and all, if some persons are doing regular Abhyanga, they will not be cause much trouble with that trauma. Then Kaphavada Nirodhana, this point was mentioned by Acharya Sushruta, Kaphavada Nirodhana. Then coming to contraindications, Varjo Abhyanga Kaphagrasta Krida Samshuddhi Ajirnipi means Kaphaja or Kapha predominant diseases, then who have undergone Vamana or Virechana Karma, then suffering from indigestion, Ajirna, and persons with Amadosha. Also, you can write that contraindications of common Snehana procedures. Next procedure in Sushrudam Chikilsa, it is mentioned that Tatra Prakriti Satmya Ritu Desha Dosha Vikaravit Tailam Kridam Va Matiman Yunjat Abhyanga Segayo. Means it is the Abhyanga is done with lukewarm medicated oil or ghee. How after examining this Prakriti, Satmya, Ritu, Desha, Dosha, etc. of that patient. Current method is using this medicated oil. It will be selected according to the prakriti and it must be 125 to 150 ml and vessel is needed, soft towel. These are the materials required. The oil will be applied first on the head, then massage the ear, palm and feet. That is Shirasravana Padeshu Tam Visheshena Shilayet. And it is done in 7 postures. These 7 postures you must be remembering every time because in each procedures we are following these 7 positions. First is sitting position, then supine. First we will sit, then supine, lying on the back. Then we will lie down and then left lateral position, then prone position. This position is contraindicated for some heart patients and with more obese persons. They cannot lie in this stomach for a long time, and then we will do it as supine itself, then right lateral, then again supine position, and then sitting position. Okay, we will be sharing a video of this YouTube link to you, and you can watch the video after hearing this theory classes. Okay, then it will be more clear to you. These are the 7 positions: sitting, supine, left lateral, prone, again prone or supine, then right lateral, then again supine, then sitting. By doing these 7 positions, every part of the body can be concentrated. While doing in sitting position, what we will do, oil is applied in the head, ears, then feet, and later to all the body parts. Now you can imagine, okay. Then later you can see the video and correct it. Then while sitting, the massage is concentrated on the head, neck, and shoulder. Then in supine position, that face, chest, abdomen, hands and legs. Like this, they will be lying in the supine position. And face, chest, abdomen, hands and legs can be done. The massage can be done. Then left lateral position. While we lie on the left lateral position, we can do the abhyanga on the right side of the body. Then in prone position, massage is concentrated on back, spine, buttocks, hands and legs. Then coming to right lateral position, left side of the body can be concentrated. Then again massage ends with the supine and sitting position. Already we have discussed that first 2 steps. That again will be repeated. And synchronized circular movements are done. This is very important. In certain regions, certain movements are advised. That is synchronized means if 2 masseurs are doing, they must be doing in the same manner. Circular movements are done over the joints, abdomen, and chest. Then longitudinal strokes or downward movements, anuloma movements, are done over the hands and legs. Circular movements over the joints, abdomen, and chest. Then longitudinal or downward anulomana movement are done over the hands and legs. Okay. Then effect on dhatu. Dhaduna pushti janano mrijavarna balaprada. That is, in Delhanacharya, describe the effect of dhatu according to this duration of its done. Then oil used in Abhyanga reaches to Romanta, Twak, Rekta, Mamsa, Meda, Asti, Majja, like that. This matra have been mentioned, and when it reaches Majja, it takes 900 matras. Okay, so Abhyanga should be applied at least 5 minutes continuously to get its maximum. That means 5 minutes in Romanta, um, like that. If we do in 30 to 45 minutes, then only that it will reach in the Majja Dhatu. Okay, then we are entering in your syllabus point. Mardana, Unmardana. That is, Mardana means applying deep pressure in downward direction in Anuloma Gadi, and in Unmardana, it is applying deep pressure in upward direction, Pratiloma Gadi. And indications are Swasthya, Vadavyadhi, Twak, Sira, Mamsa, Rekta, Snayu, Sandhi, Astigada Vada. Okay, this Mardana, Unmardana, Samvahana, these all are mentioned depending upon the pressure we apply. Okay, that is grading of pressure will be more or less considering this Mardana, Unmardana, Samvahana. The terms are different. Okay, as this pressure applying is more Kabaharatva will be there. Okay, then the types I have mentioned in the types of Abhyanga. Shushkanga Mardana, Tailanga Mardana, Kshiranga Mardana, Swayamanga Mardana, Yamalanga Mardana. This Angamardana Tiruka I have already mentioned. It is a Kannada book written by this Raghavendra Swami in the name of this Tiruka. And a scholarly article is there that is reviewed by the Dr. B.S. Praveen. That is Angamardana, a treatise on massage techniques of ancient India. It is mentioned as Shushkanga Mardana means local massage. Shushka Anga means local massage. Tailanga Mardana means using Taila. Kshiranga Mardana means using Kshira, adding Kshira with other drugs. Then Swayamanga Mardana means Swayam, self massage. Yamalanga Mardana means Yamala means two, no? While these two massages are doing, it is Yamalanga Mardana. So local massage, massage with Taila, massage with medications using Kshira, then self massage and massage by doing two massages. These are the classification of this Mardana. Next, coming to Pada Khada. You can see the picture itself, Pada Khada. We are making an Akhada to the patient, like we are just using the Pada, feet for the Abhyanga. It is more prevalent in South India, in which a person massages to person with his feet after application of medicated oils. Okay. In this procedure, more pressure is exerted than Mardana. Okay, Mardana, Unmardana, Pada Khada. This pressure will be coming more. Procedure is like this. The patient is advised to lie on the ground covered with mat. And then the masseur should stand on the side of the patient and hold the rope which is hanged. You can see in this picture. Then what they will do? They will dip the foot in the oil containing vessel and apply the oil with deep pressure of the abdomen, chest, limbs, and then on backside. Okay, he or she should be having well control and the pressure should be adequate. Okay, then comes Samvahana. Samvahana means Sukhakara Sparsha, comfortable touch. Okay, then massage for the whole body suitable to promote blood and lymphatic circulation and to induce a very deep relaxation. That is Samvahana. Samvahana, we can tell it as whole body massage or like that. Okay. It is mainly for this blood circulation and lymphatic circulation. And it can be classified into Mridu Samvahana and Tivra Samvahana. You have learned some Samvahana treatment in Sutrasthana, Ashtanga Hridaya Sutrasthana in Charaka also. That is, Mrudu Samvahana is mentioned as a treatment for Nidra Nasha, isn't it? Also, this Samvahana is mentioned in Vadarakta Chigilsa, it is there. And this Tivra Samvahana, this more pressure we will be applying. Actions are in Sushrutan Chikilsa, it is mentioned as Preeti Nidrakaram Vrishyam Kapavada Sramapaham Samvahanam Mamsa Rekta Tvak Prasadakaram Sukham. Mainly, we are doing it as Mrudu Samvahana and it will be more applicable to Vada dosha. But due to this Mamsa Rekta Tvak Prasadakaram, it may have some action to this Pitta dosha also. It can be given as a Pittahara treatment also. As this Mamsa Rekta Tvak, Rekta Prasada and Tvak Prasada is mentioned, some Pitta involvement can also be added on to this treatment, Samvahana treatment. That is, affection induces good sleep, aphrodisiac mitigates kapha and vada, pacifies fatigue due to exertion, does prasadana of mamsa, rekta and tvak. You can also write that nidranasha treatment. Next, coming to karna purana, that in the term indicates karna is filled by some liquids. Filling of ear by lukewarm sneha for a stipulated period of time is called karna purana. Method: patient is advised to lie on the massage table on supine position. Abhyanga will be done over the ear and surrounding area and neck, followed by Mridu Svedana. Like in this picture, we must do this Abhyanga and over the neck and ear area, followed by Nadi Sweda. Then the patient will be advised to lie in the lateral position, keeping the head on the pillow. Then the lukewarm medicated oil is poured slowly over the wall of the external ear and advise the patient to be in the same position for prescribed time. The same procedure should also be repeated on the other ear. Duration is 5 to 10 minutes. Okay. First Abhyanga will be done as a Purva Karma and Nadi Sweda will be done. Then the patient is advised to lie on the lateral position and then lukewarm oil will be poured slowly over the external ear, and this procedure can be repeated on the other ear also. Duration is 5 to 10 minutes. What are the benefits? Na karna roga vadotha na manya hanu sangraha na uchchair strudir na badhiryam syat nityam karna tarpanat. The person who does regularly this karna purana prevents the occurrence of vadaja karna roga, manyagraha, hanugraha, bathirya. In Shalakya subject, you will be learning more detail coming to this hanugraha, bathirya treatment. In Sushruta, it is mentioned as Hanumanya Shira Karna Shulaknam Karna Puranam. Also, it subsides the pain of jaw, neck, head, and ear. Next is Lepa. You can write this importance of Lepa and no need to study this sloka. That is, by pouring water over a burning house, how this fire is extinguished immediately. In the same manner, if we apply Lepa, the provoked dosha will be pacified by this local application of Lepa. And types of Lepa, it is Pralepa, Pradeha, and Alepa by Sushruta. Also, Doshakna, Vishakna, Varnyakna Lepa is mentioned. Then the kalka of the drugs other than sneha substances may also be used for this purpose. For Lepa, we are using different Lepas, isn't it? Then Pralepa should be, that is Pralepa, Pradeha, Alepa. Pralepa should be Shita, Tanu, Vishoshi or Avishoshi. And Pradeha should be Ushna or Shita. Gadha means thick and Avishoshi. Alepa should have intermediate nature. Okay. These are the general method of preparation. The drugs will be first made into fine powder, then mixed with some liquid media like water, cow's urine, oil, ghee to make it as a paste, and this will be applied over the skin. Some rules are to be followed. No need to study the slogas, but you can um, learn the meaning. Matter you must be well thorough. Okay. Tatra pradilomam alimbet. Pradilomehi samyak औषधम अवतिष्ठते अनुप्रविशति रोमकूपान् स्वेदवाहिभिश्च सिरामुखेर वीर्यं प्राप्नोति. By doing this pradiloma lepa, this medications will directly enter into the romakupa hair follicle, thereby svedavaha strogatas will be activated and the vasodilation or circulation will be improved and our desired effect will be achieved. By doing this pratiloma lebana, what happens? This hair follicles, the medicines or medicated drug will be entered into the romakupa hair follicle, thereby this vedavaha srodhas will be activated and this circulation, blood circulation will be increased. Nacha shushyamanam upeksheda, that is over drying will not be done with this leba. Before over drying we must wash it with hot lukewarm water. Nacha alebam ratro prayunjida, this application of leba is contraindicated in night time. This I have told. Nacha paryushidam lebam kadajit avajaret, that's leftover leba cannot be used again and again. Also this second leba, we have applied first leba and then again we are applying on this second in first leba, the thickness will be more and we cannot get the desired effect. Okay. Then coming to talam. Okay, we have discussed abhyanga, then mardana, unmardana, padakhada, samvahana, karnapurana, and then talam. Also leba. Talam, this procedure we are applying in every purva karma of this procedure. While we are in sitting posture, we will be applying in more commonly in South India, in Kerala, we practice this talam in every procedure. The application of suitable medicine in appropriate medium, that is very important, by locating the shallow depression in the center of scalp at a distance of extended index finger and thumb from the tip of nose, which approximately corresponds to 8 inches. And that is, if we are insisting a patient for a say for abhyanga, we are advising the patient to sit in the droni and we will do this tala. First, we will be doing this tala by looking what the center of scalp. There is extended index finger and thumb. From the tip of the nose, we will be doing so many what this references are there with this relating to this tala. Like this we can do, like this we can do, but we are practicing with this index finger and thumb from the tip of the nose. We will be taking here and we will be doing tala in this area. Okay. If we look for this different tala, we have this Rasnadi Churna. Simple Rasnadi Churna can be applied in this Ruksha Kriyas. Ruksha and Snigdha. You may be knowing this Ruksha and Snigdha. That is, Ruksha means dry treatment without any Sneha Dravya, without any oil. But Snigdha treatment means using this oil, ghee or anything. Okay, but if we are doing a Ruksha treatment, that is, say for example, Udvartana, we will be doing talam with Rasnadi Churna. We will be applying Rasnadi Churna here. And if we consider this Abhyanga, a Snigdha treatment, we will be doing